Hello, and welcome to the Hack My Age podcast. I am super excited to share what we need to know when we go to our first appointment with our doctor to talk about menopause and hormone therapy. Really, honestly, don't go to your doctor until you listen to this. It's so important. I am going to go through all the little steps that I speak about constantly in our biohacking menopause group. And what really prompted this episode was that I have a friend who called me in a total panic, hasn't listened to anything I've said, never listens to the podcast, and very, very stressed out about her hot flashes and her menopause experience. I went through so much with her. And then she went to her first doctor's appointment, spent about 3 hours coaching her and talking about it. And so I figured this is probably something really important. And I know I get these questions all the time. So I really want you to be prepared. It is really important. When you understand what to expect, when you prepare yourself, you are so much more empowered. It's really important you do this. So before we get into the episode, I want to just make a couple of announcements. If you're listening to the podcast and you enjoy it, please share, like, and review it on Apple Podcasts, Spotify, or wherever you listen to your episodes. And this is July, and we're having a giveaway in the Biohacking Menopause membership group. This is a private women's only membership where we can talk safely in an intimate space. We know exactly who's in there. We have live experts coming on. I'm super excited that we've got Dr. David Rosensweet's coming today. So by the time this podcast episode is released, you'll miss that, but there were so many other great experts coming on. We have Nicolina Lauk, who's going to talk about biological age test kits. Dr. Indra Bharathan, she's a functional medicine doctor. She is on every single month just for you to answer your questions about menopause and hormones. So for those guests, you need to sign up before August 1st. Okay, those are our July guests. And next month, we've got Dr. Sarah Ballantyne, who is just a fabulous researcher. She's all about nutrition and nutrient density. She's going to tell us how to eat during our menopausal years. And these are not presentations. These are here just to ask your questions. Do I eat eggs? Do I not eat eggs? Yeah. Certain things like that. And then we've got Jody Harrison Bauer. She is I think she's one of the oldest swimsuit model, Sports Illustrated swimsuit model. We did a great podcast with her too, and she's going to talk all about body composition and training and nutrition, fitness, and all that. And we have Dr. Carol Peterson. Oh, she's not a doctor, sorry, Carol Peterson. She's a compounding pharmacist, and she's also going to come on and talk about hormones and menopause. So if you want to grab those people, including me, of course, you have live Q&As with me, and I teach women breath work. We have our breath work sessions. You got to sign up for these guests before September 1st. So I would love to see you there. Now let's get into the episode. I want to share a little bit about my own personal experience. When I first started looking at hormones, I was 50 years old. I wasn't having any symptoms, but I had a lot of feedback from you saying, you know what, this biohacking stuff is pretty cool, but we want to know more about hormones and more about menopause. So this is why we are now a menopause podcast. So when I was looking for some help in terms of my menopause journey, I really thought, I just want to be prepared. I want a smooth transition. I had no idea about hormones. I was unsure. I was scared. I was one of those people, I was affected by the Women's Health Initiative study. My mother died of breast cancer. There was a lot of uncertainty there. And so what I did, I talked to my friends. I called my biohacking besties. I listened to podcasts. I read books. I started learning more and more. And eventually I found some doctors who got me started. And so this episode really is triggered by this friend of mine who knew much less than I did, even at the time. So the question is, you want to ask yourself first, are you in perimenopause? or are you premenopause? So premenopause is the years that when you start having your period until your period goes a little wonky. Or even you can have regular periods, but if you were to test your hormones, you would see that they are fluctuating. And perimenopause is that stage, and it usually starts in your 40s and it can last into your 50s on average. Of course, there's a huge range. There can be women in perimenopause very often in their 30s because we start to lose our progesterone when we're 35, right? And it takes a steep decline. And you may not even be aware that your anxiety, ADHD, or your stress, your moodiness is related to the loss of progesterone. So be aware of that. So you want to ask yourself, are you in menopause, perimenopause? And of course, if you are in menopause, that's the date when you have 12 consecutive months without your period. So if you've lost your period for 6 months, but then it came back, you got to start the clock all over again. But you're probably in perimenopause. Well, you for sure are in perimenopause. But if you're still unsure, go to the hackmyage.com website. I have a quiz. It's the first thing you see. Take the quiz and you're going to figure out where you are. So you want to look out for some of the common symptoms when you're in perimenopause. That may be periods coming and going. Maybe they're heavier or they're lighter than usual. They're not exactly on to date. Maybe you're having a hot flash. Maybe you are just getting a little sweaty at night. You want to kind of think about those common symptoms, but there are about 100 symptoms of menopause. And most women think about 2 or 3 of them and go, oh, I'm not in menopause or perimenopause. But in fact, you could very well be. So go to the website as well, hackmyage.com. You're going to find some freebies and some blog articles. You can join our membership. There's a lot of information there on that website. So you also want to ask yourself, and write this down if you want to, what symptoms am I experiencing? And I have an article on symptoms, or you can just Google it. What are the top 20, let's say, most common symptoms of menopause? You want to ask yourself how severe and how frequent they are. And you want to ask yourself too, what are my health priorities and my concerns? Okay. And that's going to launch you into if you're going to go look for a menopause doctor or not. Okay. And that's your decision. Now, if you are in perimenopause and you do want to have help, then you're going to have to find yourself a doctor. And it's really, really important that you find somebody that you like, that you trust, that you resonate with, that you're comfortable with, someone who listens to you, someone who asks you the right questions and gives you the information that you're looking for, that can test if you want to, and doesn't gaslight you at all. Okay. So a couple of ways you can do this. One, always a good thing to ask your friends, talk about menopause, open that conversation, and see if they're happy with their doctor. And if they are, you may want to go test her or him out. And if your friends don't want to talk about it, or they don't like their doctor, okay, there are a lot of things that you can do. You can find well, first you can go to Google as well. You can do a little Google search and you can look for menopause doctors, your area, something like that. And then you want to read reviews. You want to learn as much as you can about that doctor, go and scan the website. And if that's not giving you any clues, then you can go find a compounding pharmacist, right? You can Google that or ask your friends where they're getting their compounded hormones if they're using those. And you can go to the Women's International Pharmacy. That's women'sinternational.com. It's now called Belmar Pharmacy. This is US only, keep in mind. Or you can go to pccarx.com. That's the Professional Compounding Centers of America. And I'll have links to those in the show notes and why do I say this? Well, because compounding pharmacists, they see what the doctors are doing. They see what most doctors are putting together. They're seeing who is formulating great formulas, right? So it's a great place to look for a doctor as well. And the last resort, you can always go to my website, hackmyage.com. And I have an article, Find a Menopause Doctor. And I'll have this link in the show notes too. And so you can go to the menopause method for US people. Okay. I'll have links to that. It's called, I think it's the menopause. I think it's called menopausemethod.com. You can go to KarenMartel.com if you're in the US or Canada. She's not a doctor. Well, she's, my menopause bestie. She also has a great podcast called The Hormone Solution. And she works with doctors all around the country, and she can help guide you there and get these doctors to prescribe for you. You can go to the Menopause Society. That's in the US. Find a doctor that's trained with menopause medicine. You can go to websites like MIDI, MIDI, or Alloy. These, keep in mind, are very interested in just treating your symptoms. Same thing for Menopause Society doctors. Those kind of doctors are going to help you alleviate the symptoms, but they're not necessarily looking at the types of levels that you may need to protect your bones, your heart, your brain, things like that. If you're looking for health optimization, looking a little bit further down, then you're going to have to maybe check out some of the doctors that I've posted on the website, or ask me. You can also do a Google search for functional medicine doctors. You can go to the A4M.com. It's A, the number 4, and M, and these will have doctors that are into health optimization. So those doctors may more likely be thinking about your future self. But again, make sure that they're trained in menopause too, because just because they're a functional medicine doctor doesn't mean they know how to deal with menopause. And you can also, if you're in Europe, you can look at the European Menopause and Andropause Society. There's doctor recommendations there. The British Menopause Society, if you're in the UK. And if you're in Asia, the Australasian Menopause Society. Oh, there's so many ways to find a menopause doctor. And of course, in my blog, where I have how to find a doctor, you're going to find doctors who have been recommended by our community, right? Not only the things that I just listed here, but you can find them in that blog article. And of course, you're always welcome to join the Biohacking Menopause group or post on Facebook. It's also called Biohacking Menopause, or any other menopause groups. And you can just make a post like, who's happy with their doctor? I'd like to know. And I'm in this area, wherever you are. So Facebook's another great resource. It doesn't mean that their doctor is great and perfect and will work for you. It just gives you a lead. So I've had, I know people who so happy with their doctor and then recommend it to someone else, and they're like, nope, not resonating with me at all. So don't fret. There are many, many out there. Some of the questions, let's see, that you want to ask your doctor. I want you to make a list of questions to ask the doctor, not just go in there blindly like, I don't know. I don't even know why I'm here, or I'm feeling a hot flash, or whatever. Go and write down the things that you want. I want you to also look for confidence in your doctor. Okay. So in addition to presenting, say, your symptom list or things that you're feeling, and your medical history, for example, this kind of goes without saying. I want you to look for a doctor that is confident, kind of knows what they're doing. I've met people who have seen a quote unquote menopause doctor, and that doctor doesn't even know what the word bioidentical hormones means. And that's kind of a red flag. So here's question 1. You want to look. We can ask your doctor, or this doctor, or you probably more likely to do a little search beforehand, before the appointment, when you're shopping for your doctor. Where were you trained in menopause medicine, and for how long have you been treating women in this phase of life? Question 1. Okay. You want to ask yourself. You can ask the doctor directly, or just Google it. The second question is, do you treat just the symptoms, or measure and use dosages that are beneficial for my future self? Okay, that means you are concerned perhaps about Alzheimer's, or osteoporosis, or heart disease, or your thyroid, or whatever, right? This is something that I think is quite important. So not just treating the symptoms. And that's what some of these websites do, these menopause treatment centers, which I think are great, because at least they're doing something, but they may or may not be a great fit for you if you're looking for protection for your future self. The other question is, what are the risks and benefits of hormone therapy or some other treatment that they present you? Okay, you want to get the full picture. on the risks versus benefits. Hopefully, you will have done some reading or research or listened to other podcasts or other doctors, and you're kind of up to speed with that. But just in case, you want to hear their opinion anyways to see if it's in alignment with yours. The next question is, how do my personal and family medical histories or lifestyle and diet affect my suitability for hormone replacement therapy? Okay. And the next question, it's really important, okay, is what are the risks and versus the benefits if I do not take hormone therapy? No one ever seems to ask that question. And it's a really important one because not going on it, of course, is a perfectly valid choice. And so there are risks and benefits to both sides of the coin. Dr. David Rosensweet, who I trained with in the menopause method, this is with the Institute of Bioidentical Medicine. So you can see we're, pretty biased on bioidentical hormones. But what he presented to me was this is the theory of, well, you got to ask your doctor what is the risk of no treatment. And he says that bearing in mind that with ovarian hormone declines, there is a near certainty of loss of energy, poor sleep, mood, low libido, weight issues, which can lead to metabolic disorders and then other diseases of aging, metabolism, functioning of everything, he says, sarcopenia, vaginal prolapse, bladder infections, incontinence, atrophy, recurrent cystitis, and all of this can lead us to adult diapers. We're not talking about today, but we're talking about our future selves when we're in our 70s and our 80s, right? Osteoporosis, artery issues, cardiovascular health issues, your brain, right? Mental health, dementia, cognitive decline, and we have increased risk for Alzheimer's. Sarcopenia, meaning he likes to describe this as, well, may wind up with canes and walkers and wheelchairs and those little scooters. Osteopenia, osteoporosis, I already mentioned that one, vaginal atrophy, hair, skin, and nails, of course. And I don't want to scare you. Of course, this is Dr. Rosensweet saying that there's a near certainty of, okay, doesn't mean everyone will have this. And we also can do a lot of things to help all of these issues outside of taking hormones too. I always say you can't add hormone a bad diet and lifestyle. So even if you are taking hormones, you still need to work hard. It's not a free ticket, right? And again, just because you cannot or do not or choose not to take hormones, it doesn't mean it's all doom and gloom, okay? But it is kind of scary if you kind of listen to some of these doctors and you go, well, okay, what do I want? The next question you want to ask your doctor are, what are my treatment options? And this can get really confusing. And I will certainly do a podcast episode on all of the choices that we have out there. And there's things that are transdermal, meaning going through the skin, a cream, a gel, oil, patches, drops, serums, the pessary, vaginal rings, so many things that we can do. Or there's orals, taking an oral hormone, pellets, implants, pellets are implants, injectables or drugs or lifestyle or whatever. Okay. The doctor may have a lot of options for you. Hopefully you'll have a choice. And then you want to understand the risks and benefits of these choices or the conveniences and inconveniences of each of these options, because some things you do every day, some things you do on a weekly basis, other things maybe you do on a monthly basis. So because there's so many options, you got to really dig deep, okay, and what this actually means for you. You also want to know what are the difference in cost with all the variety of types and methods of hormone therapy, and ask, is this covered by insurance? Because sometimes it's real cheap in some parts of the world, doesn't even matter. Other times it's going to cost a fortune. So please ask about cost. The next question is, how long do I need hormone therapy for? Personally, I would say as long as you want to feel good, right? Or as long as you are interested in protecting your bones, your brain, your heart, whatever. And again, this has to be discussed with your doctor because you have to figure out if this is going to be convenient for you, not convenient for you, a risk for you, or benefit for you, whatever. But ask that question, how long do I stay on hormone therapy? Another question is, how does HRT affect other health conditions that I currently have? Maybe you have thyroid issues. Maybe you're obese. Maybe you have sarcopenia already or osteoporosis, cholesterol problems, diabetes, insulin resistance, which is not uncommon in this phase of life, hypertension, whatever personal condition you have, autoimmune diseases, like the list goes on and on. So ask how those hormone therapy can help or hinder or affect your condition. What recent research or developments should I be aware of? That's another question that you may want to ask. Okay. That's a good question to see if your doctor is up to date with the latest research because it's changing day by day. And you may want to ask if there are new studies or treatments on the horizon that may be relevant to your situation. So, for example, if you have Alzheimer's in your family and you're concerned about it, or you have the ApoE4 gene, you may want to hear that doctor talk about Dr. Lisa Mosconi's work with the brain and menopause and hormones. So that's just an example. Another question to ask is, are there any lifestyle changes I should consider? That's a good one because it's not just about taking hormones, right? The next question is, where do I apply the hormones and how? Some doctors like to cycle progesterone in and out. Some like to have a static dosage. You got to know. If you're taking an estrogen cream, for example, I've been trained that the best area is the soft forearm, your forearm. Okay. And there's, so circulation is really good in this area. Absorption is really great in this area until it isn't. And you may have to change areas. That's like a whole other podcast. Progesterone can be done on the inner arms. It can be done in your abdomen, inner thighs. You may want to, if you have breast sensitivity, you can try rubbing the cream on the breasts or ask your doctor, of course, and that may help reduce the breast tenderness. If you have fibrocystic breasts as well, but it may make things worse too. So again, this is the whole self-experimentation, self-titration issue, but talk to your doctor about that. You don't want to generally ever, we don't put these hormones on our lower legs. It's usually not recommended. I've heard of you can put sometimes on the bottom of your feet. Again, at your own risk. And then the rotation. Okay. When you're really just starting out with trying to determine which dosage is good for you, the forearms is really good, but sometimes you may not feel anything and you may go, oh, well, I just need more. Maybe you need more, but maybe you need to just put it somewhere else too. So you can try putting those hormones on different parts of the body. And then once you find a place, keep going until maybe you don't see it's not working anymore. Or you may want to even in your head, you can also try maybe 3-4 months and then rotate it to see if there's any difference. And again, this is a question for your doctor, and your doctor probably has a certain method that he or she likes, and then just go with it. Try it. Just because I say this doesn't mean it's gold, right? Another question is, how will we monitor if the HRT is working or not? Such an important question to ask because you don't want to be just getting your prescription and be on your merry way. Well, you need to know. What should you know? Another question is, what do I do if I need help self-titrating and I have more questions? How often do I need follow-up appointments? Right? These are important questions because I've learned through the menopause method that it's about 25% of the women who get it spot on, feel great, are in perfect ranges. What about the other 75%? They may go, it's not working, nothing's happening, or I feel worse, right? This is so common to happen, okay? So please make sure you are in contact with the doctor, what to do, and then what you do about follow-up appointments. Another question is, what testing should I be doing, right? Are you going to do the Dutch test eventually, that dried urine test of comprehensive hormones, or 24-hour hormone serum, 24-hour urine test to test your metabolites? Are you going to do serum and blood testing? You're going to check your testosterone levels if you're on testosterone. You're going to check your bone density, get a cervical scan, look at your cardiovascular markers, get a mammogram. thyroid issues? Like these are questions that can, that you should be taking advantage of when you see your doctor. So I'm going to have those questions. And I'm not sure if I can list all of those in the show notes, but I will have a blog article leading to that. What about the questions the doctor should be asking you? Again, this is so important. This is what I learned with the Institute of Bioidentical Medicine, because this is a doctor's training program. They allowed me to take it. I'm not a doctor, but they allowed me to watch and take the tests and take the exam and follow through. And this is what they're teaching doctors. I think it's brilliant. You give a very comprehensive questionnaire that the patient needs to fill out before they arrive, because it's really long. They want to know everything about you. That's amazing. I always, that those doctors get major brownie points with me. So in that questionnaire, there should be obviously your age and your family history of diseases. That doctor should be asking you for any recent labs or images, reports, pathology, whatever. Send it ahead of time if it's recent, and actually look at them. You know how many doctors I've seen, and I've sent them everything, and I know they haven't looked at it. It's so frustrating. Like, why did I put this all together for you? So a good doctor will actually look at them. Another question that you should be having on that questionnaire is a history of your periods, even when you don't have them anymore. When was the last period? When were they last regular? How old were you when your periods started? And what were your periods like then? And what are they like now? What's the flow? How many days do you have PMS? Like, these are all really good clues for a doctor in terms of trying to prescribe a dosage for you. So the next questions that you should be asked are based on your birth control history. Did you ever take it? How old were you when you took it? What kind? How long? How did you feel on it? What happened when you went off? Things like that. Pregnancy is also a great determinator on how to dosage a patient. How many times were you pregnant? At what age were you? Did you have any miscarriages? How many births were successful? How many abortions were there? All these things. And then I want the doctor to list give you a list of symptoms, because there's so many that you may not be aware of. Most women are thinking period problems, or like no period, hot flashes and night sweats, and sleep disturbances. Maybe some women are aware of moodiness. Okay. That's all. And if you're not having any of those, I've met so many women who go, I'm not in menopause, or I don't feel menopause. And yet they actually are. So when you have a full-on questionnaire asking you about symptoms, it not only gives the doctor clues if you're estrogen dominant, if you're low on progesterone or testosterone, or an excess on it. Okay. So in that questionnaire, you may want to even ask yourself, if the doctor's not asking, are you kicking off the covers at night? That was me. I was like, I don't have hot flashes and night sweats. But when Dr. Rosensweet says, did you kick off the covers at night? I'm like, well, yeah, I wasn't sweating or anything, but yeah, I was getting kind of hot the week before my period. So that gave him a clue. Again, the full on history of your periods, if you still have them. Are they frequent? Are they infrequent? Are they gone? Are they painful? Are they heavy? Are they light? All that stuff. Do you have back pain or joint pain? Right? Sometimes we think, oh, this is aging. Well, yeah, aging may be part of it, but maybe your hormones have a lot to do with it too. Vaginal issues, vaginal dryness, pain during sex, leakage, bladder issues, infections, incontinence, frequent waking up to pee, or having that urgency, like, oh my God, I was totally fine until a second ago and suddenly I have to pee. Well, that's estrogen deficiency, right? So more clues. Libido, that should be a question. I actually was consulting, I don't want to go into the story, but a young man in India who was concerned about his mom. And I managed to get him to a doctor. And then he sent me a little message saying, the doctor asked about her sex life. I mean, he was really skeptical. He was like, that's not right. You can't be talking about that. And I reassured him that was actually a very appropriate question, but it was just embarrassing because he was there with his mom. I don't think my kids would ever want to hear about my sex life. So, libido, is it diminished? Do you have a low libido? Do you feel like you are just not as sexual as before or as sensual as you used to be? You don't have any intimacy anymore, or maybe you have an overdrive, right? There are women who go through menopause and their libido is like skyrocketing through the roof. So share all that information with the doctor, or doctor should be asking you this. The doctor, of course, will ask about the sleep. Do you have a racing mind at night? Right? That's low progesterone. Do you wake up a lot? Do you have trouble falling asleep or staying asleep? Do you wake up too early? All these questions are really important because those give clues. Bloating, gut issues. Do you have hair loss? And again, hair loss could be the loss of your sex hormones. It could be thyroid. It could be a nutrient deficiency. There could be so many other things. But the more of these things that you list, the doctor gets more clues. Then about your mood, your brain. Are you depressed? Are you moody? Do you have anxiety? Are you nervous more often than usual? Are you angry more often than usual? Are you sad, weepy, crying for no reason, impatient, snappy, maybe snappy with a clear mind? Are you indecisive? And these are changes that maybe you've noticed throughout a decade or so, right? Because if this started in your 30s and you're now in your 50s or late 40s, could be hormones, right? Are you gaining weight, especially weight gain for no reason at all? Everything stayed the same. Do you have a diminished love of your body or body image? Because our body changes, right? And that, again, another clue. Cognitive function, brain fog, forgetfulness, attention deficit disorder. Do you get headaches and migraines? Um, Imagine if you've been dealing with migraines for 20 years and suddenly you just top up your hormones and they go away. Like, what a friggin' miracle. Not saying that may be the solution, but for many women I've seen, that's a solution. Heart palpitations, chest pain. Remember Oprah, like her story where she was going to every single cardiologist trying to figure out why she's feels like she's going to have a heart attack. Well, she was just going through menopause, perimenopause to menopause, right? Breast or nipple tenderness or pain. It's a sign of maybe too much estrogen. Breast swelling, dense breasts. You got to tell your doctor if you have dense breasts or not. Fibrocystic breasts, another clue. Are you feeling nauseous? Do you have phantom smells? Phantom smells are the ones where you smell smoke, for example, or gasoline or something, and no one else does. And it's never something like chocolate chip cookies. Like it's always some weird smell. No one else smells it except you. Pelvic cramps, okay, endometriosis, fibroids. These should be in your history take-up form. Are you really much more tired than before? Do you have low stamina? Do you have muscle cramps, muscle loss, flabbiness, weakness? Is it hard to stand up from a squat or off the floor? Do you have less coordination and balance? And again, you may go, oh, this is aging. Well, partly we're getting older, yes, but very often, if you're in this phase of life, could be loss of your sex hormones or something else, but have a good doctor help you tweak these things out because hormones are the low hanging fruit, right? It's so much easier to take the hormones that are so often beneficial for us rather than a medicine that has side effects, right? So again, if the hormones are not helping, at least your hormones are in balance. You figure that piece out and then you move on to the next thing because that will certainly support whatever else that you do. Do you have less motivation? Maybe less aggressive than before. Maybe you have a lost sense of security. These are all things that you would never think about menopause, but could be very well related. Do you have less hair on your body, less pubic hair, less body hair, fewer hairs in your armpit? And then you want the doctor to ask you. These are just, I just rattle off symptoms that should be asked by your doctor because you may not even be thinking of them. And then the last few questions the doctor should ask you is, how do these symptoms affect your daily life? Like, if you don't care about less armpit hair, I probably wouldn't. Then we don't need to bring it back, right? The other thing is, yeah, if it's not so disruptive, and if your goal is to alleviate symptoms only, then that's good enough. But I strongly encourage you to challenge your doctor to help you stay your best as you age, okay, and protect your future self. And then the next question, the very last question you should be asking you is, are you taking any medications or supplements? Okay. There we go. Those are the questions the doctor should ask you. Now, what do you want to avoid? You want to reduce the risk of anything as close to zero as possible, right? We are at risks for everything, right? So the game is, there's never 100% risk free, right? Uh, Doing nothing is not 100% risk free. So we just want to get as close to zero as possible. So what I'd like you to make a list of things you generally want to avoid if you can and you have a choice is synthetic hormones, things like Premarin or Prempro, progestins. Progestin is not the same thing as progesterone. Okay, it's a synthetic. Why use synthetic when we have bioidentical hormones? And again, ask your doctor about bioidentical hormones. I would avoid pellets. I'm not a fan, but I met plenty of women who love them. So, I don't want to say they're all bad. It's just that pellets, you implant this into your skin, and it gives you like a 3-month supply of a combination of hormones. The problem is when you're just trying to figure this out, you may have an overdose of one or the other, and that stuff is stuck in your body for 3 months, and you got to wait. And so you don't really want to be playing around with pellets, especially when you are just learning what your dosage is. Try to avoid oral estrogen if you can. And it's, there's a big difference between oral and transdermal estrogen. Okay, oral is a capsule, a pill, or something. That's a synthetic. And it usually comes from conjugated equine estrogen. It's coming from a horse. And there's not only the estrogens that you may need, but there's a lot of other estrogens. I think I heard the number like 51 other estrogens or something crazy like that, that you probably don't need. And then we have transdermal, which is it's something you rub on your skin. Okay. And there's a pretty big difference when you're looking at the research. So the transdermal, when you put in a cream or a gel on your skin, it bypasses liver metabolism. Okay. And so that makes the estrogen more bioavailable. Okay. So you have better when you're testing serum levels in blood levels of your estradiol, you can see it better. All right. You don't have these crazy concentrations of estrogen inside your liver, right? And it can have what we call a less pronounced effect on hepatic protein synthesis. So that's just less of an effect on your liver, right? You have less inflammatory markers when you take transdermal. Oral estrogen increases markers of coagulation and steroid binding proteins, so like sex hormone binding globulin, and that may lower your testosterone availability and then your libido. So all of this is super connected. And of course, with the oral estrogen, we've shown that you have an increase in heart attacks and stroke. So, there's sometimes when women go, oh, estrogen causes cancer or estrogen causes, heart attacks. Well, no, but yes, right? The heart attack component, when it's a synthetic estrogen, yeah, they're right in that sense. So we tend to clot more, and this is a problem. So you try to avoid the oral estrogen. Now, you may not have a choice. Maybe that's for one reason or another, that's your choice. It's better than nothing, okay? And you just ask your doctor to monitor your heart health, okay? So avoid, if you can, estrogen only prescriptions, unless you don't have a uterus. But I still think even if you don't have a uterus, it's so great to have progesterone on board for your future self. Okay. Again, if you're just looking at lowering the symptoms, maybe that's okay. But estrogen, so a doctor will tell you, quote unquote, the main function of progesterone is to prepare the endometrium lining. This is endometrium, is the lining of your uterus for a fertilized egg to implant and to grow. Right? This is for pregnancy. And if the pregnancy doesn't happen, then progesterone increases. Then progesterone increases if the conception does happen, then if the egg is implanted, then progesterone increases in order to support the pregnancy. Okay. So if it's not getting pregnant, then the endometrium needs to shed, right? That's your period, right? So we need that. That's why if you don't have a uterus, all this stuff goes out the window. However, progesterone, it helps us with our sleep, mood, make our periods lighter if you're dealing with heavy periods. It helps with our bones, our brain, our heart. There's just so many great functions. Like, I don't understand why a doctor wouldn't give you progesterone, even if you don't have a uterus. But if you do have your uterus, absolutely must have progesterone together to protect that uterine lining. Otherwise, it builds up, and it doesn't shed. So that's a breeding ground for ovarian cancer, right? So again, this is some of the nuances. The other thing you don't want to do when you start your hormone therapy is go too much, too fast, too soon, especially if you're a sensitive type. And this is just when you're getting started. If you're a sensitive type, that means you're sensitive to food, you're sensitive to the air, you're sensitive to creams, you're sensitive to like everything. You know who you are. Those people really need to be going slow and low. And you always just build up. Okay. Estrogen and progesterone first is what I really like women to start with. Everything else can come later, like their testosterone, everything else. I mean, if you're just looking at your hormones, right? DHEA, whatever it is that you want to take. Estrogen, progesterone first. If your doctor says, no, I just want to get you on progesterone, that's fine too. It's a good starting point. Maybe if you're in your very, very early perimenopausal stages, you may not need estrogen. That's why I think it's really good to test if you're in the early phase. You can see if your estrogen's still good or not and regular, but you may need the progesterone. And so if there's one thing you're going to start with the progesterone. And if you're in the early stages, but if you're already dealing with hot flashes and all these symptoms, it's not going to be enough. And the last thing I really want you to make sure is or be aware of or avoid. This is all about what you should be avoiding. Avoid doctors who are not confident and who don't know what they're talking about. Okay. If you're teaching them more than them teaching you, then you need to find another doctor. Because doctors basically need to understand menopause medicine really well. They need to use the right preparation. They need bioidentical whenever possible, the right formula, the right ratio, the right route, the right method of delivery, the right base. Don't overdose, don't underdose. Test your hormones. I really like testing. I understand there is a moment when to test. With testing, this is a whole other podcast. You don't necessarily need to test your hormones before, but if you're taking the hormone therapy, I think it's always a good idea to test once you're pretty much stable. And then ask your doctor also about what you need to do to check your breasts, your uterus, your bones, whatever testing you need to do annually or biannually, whatever it is. Because if you got osteopenia, you want to be taking a DIXA scan after doing some kind of a protocol. Okay, let's continue. I propose shared informed decision making. Okay. We need to make these decisions together with your doctor. Okay. You need to be informed and you got to give some choice. So go to your doctor prepared, educate yourself, print or have on your phone somewhere the research that you're looking at, because the doctor will poo-poo whoever you're listening to, like me, because I'm not a doctor, but we have all the research, so you can get it. And show the doctor that you can speak on their level. Like they don't need to baby talk you, baby talk to you. You know what you're talking about. And just when you are informed and better prepared, you can make better health decisions for yourself. Ask your questions, be curious, be skeptical. You can be polite if you don't agree, but be firm in your own beliefs, whatever that is. And then identify if the doctor has a bias. Okay. Sometimes doctors want to bully you into taking hormones or bully you out of taking hormones. It doesn't matter. They should not be doing that. You should be expressing your needs and your thoughts and your beliefs. And if you see that the doctor has a bias, make a note of it and then maybe go and get a second or third opinion if you need. You are shopping for a doctor, right? You can choose who's going to help you through this. And explain to the doctor that you're looking for an unbiased opinion and you want to have a spectrum of choices. And you can also ask the doctor, do you have any resources for me? Or you may say, you know what, I need a little bit more time. That's perfectly okay. At the end of the appointment, what do? You want to ask what to do when you don't feel right. How do you maintain the communication with your doctor in between appointments? Can you email them? Can you call the secretary? Do they have like a membership program where you have communication? Like you don't want to be left in the dust, right? Because you may feel side effects that are either not side effects that you don't like or no effect at all. And you don't want to wait a whole year until you see the doctor again, right? Ask your doctor how to self titrate and how to report any of the changes that you make and the things that you feel with the doctor. If you don't know how to self titrate, ask the doctor to teach you. If not, you can get a cheat sheet with how to determine your own dosage. And of course, communicate all of this stuff to your doctor if you do use this cheat sheet. If you need more help, if your doctor's not going to hold your hand, then join me in the Biohacking Menopause membership group because I'm there and we have all the doctors in there who can give second opinions too. So please consider joining us there if you're left in the dust. And then you want to ask the doctor as well, what do you test for in the future for other issues that you have, whether it's diabetes or thyroid issues, autoimmune disease, osteopenia. There's so many other things that you need to be monitoring other than just your sex hormones. And then basic blood tests, I would say eventually you want to get to your doctor. I have a list here. Get your pen and paper out. I'll have a blog article on this too. This is what Dr. David Rosensweet likes his doctors to ask for when he did the menopause method training. So he wants a complete blood count, CBC. There's 7 different types of cells, and it gives a lot of information about your immune system. Get a CMP, that's a comprehensive metabolic panel, and that looks at the body's fluid balance. It looks at the levels of electrolytes that you have, like sodium and potassium, and it gives the doctors a clue how your kidneys and liver are working, right? And then the third one, okay, there's only 3 that are really, really important, are your cardiovascular markers, a full blood lipid panel. Okay, these are all blood serum tests. So it's generally the total cholesterol, your HDL, your LDL, and then you gotta get granular. So it depends on how much your insurance covers or not, because if some of these markers are not optimal, then you want to take a deeper dive into particle size, particle number. Is your cholesterol oxidizing, things like that. I've got a great episode with Dr. Elizabeth Yorth on cardiovascular health and what your doctor generally doesn't tell you, and what markers to get. There's a whole show notes on that. Additional ones that I encourage you to get anyways are thyroid. That's the free T4, free T3, reverse T3, and your TSH. Don't just get the TSH. Doesn't tell you a whole lot. And SHBG, this is sex hormone binding globulin. These are great additions for the doctor if you can. Now, Other ones that you may also want to get, and again, this depends on your budget, depends on what your doctor is open to, is HbA1c and insulin. This talks about your insulin sensitivity. It helps you just figure out if you're gaining weight and you're not really sure what's going on, it gives you a clue. Then you get an HSCRP. This is a high sensitivity test for your inflammation. It's an inflammation marker. Homocysteine is another great one to get. FSH, and LH. These are typical ones that these are usually the ones that the doctors give you all the time when they want to determine if you're in menopause or not. It doesn't really need to determine things if you're in menopause or not, because you're probably at the doctor because you're not feeling so good, or you just really want to make sure you have a smooth transition. And I just learned from Dr. Lindsay Berkson. She's an incredible doctor who knows a lot about hormones and menopause. She just said that if your FSH is in the 70s and 90s, if that doesn't come down with your hormone therapy, your brain is not protected. Okay. This is just one source. Do your own research, but I was really interested. Yeah, she gave us a number there. The other ones you want to get is DHEA, S, and testosterone. You want your free testosterone, your total testosterone. And there's so many other possibilities. Then you want to get tested on whatever problems you may have in addition. And then the next thing you want to do, the very last thing you want to do with the doctor, is discuss the plan. Again, follow-up appointments. When does that happen? How are you going to monitor your progress? It's not only the hormones, but there's other points that are probably important to you, like your bone health, your gut health, other things. So make a plan. Don't go, oh, I'll see you next year. Then you're going to discuss how to prepare for these appointments and what to expect. Okay. Is there anything you need, any blood work you need to be doing? Is there any testing you need to do before you come in? And then again, what do you expect, right? If you come in, maybe everything's going to be hunky dory. You just take your hormones, you're feeling great. You come in, follow appointment, then they check your levels, make sure that you're in this Goldilocks zone. Everything's perfect. Great. That's like a happy ending. And then you want to schedule. So before you leave that first appointment, schedule the second appointment and talk about what the purpose is too, right? Is it adjust your treatment plan? Is it to follow up with something that came up? And during the time that you're gone, in between appointments, track your symptoms and your progress, right? So that you have something to take in for that second appointment. So, and then generally after 2 or 3 meetings with your doctor, hopefully your hormones are pretty stable. You figured out your optimal dosage. And that's when I would ask, perhaps we can do a Dutch test, a dried urine test, or a 24-hour urine test. Let's check the metabolites. Now, again, if your doctor's not into this, they can poo-poo it and say you don't need it. And that's up to you, right? If you trust your doctor and doctor is like spot on with everything else, well, then maybe you can let that one go. Now, in conclusion, we want to be really well prepared, right? I'm going to sum up what we talked about. We want to be informed for this first appointment. It's so empowering when you go in there knowing what you know. This is your body. It's your health, your temple that you live in, your family that's affected, and it's your future self. Is that important to you? If it is, go and do the work, because you don't want to walk into this first appointment blind and then disappointed, right? Get empowered, right? Read up, educate yourself on menopause and hormones. We all don't agree on every single point, but just do your own due diligence. Go find your doctor. Go find someone who is qualified, who's trained and experienced in menopause medicine. Bring your resources to you. Make your list of questions. Write down the questions you want to be asked. Bring them up if the doctor's not bringing them up. Know what you want and what you don't want, and then make that shared, informed decision together with your doctor and make the plan for the future appointments. And then again, what is the communication that's going to happen in between those appointments? And don't forget any other aspects of your health. It's not just about sex hormones. It's not just about that hot flash. Everything is connected. And the last thing, don't accept any gaslighting and egos, right? If your doctor is gaslighting you, got a big ego, go and find another doctor. There's so many out there. All right. If you're still listening and you got this far, you've got this. You are important and you're worthy of feeling your best through this transition, right? This is going to be the best years of your life, right? The kids are gone, or you're making maybe a transition in life. You're free. Now you don't have as much responsibilities if you had kids. Maybe you're taking care of aging parents, something else, but you got to be in a good condition if you're going to take care of those parents. So download. I got a ton of freebies on the website, resources, other podcasts, books that I read. There's so much going on at hackmyage.com. If you like this episode, please share it with somebody or tell me. It's always nice to hear feedback. Subscribe, rate, and review the podcast. So thank you so much for tuning in. Join me in the Biohacking Menopause membership group, or download any of the menopause programs. We got them on Energy and Hot Flashes. It's all on hackmyage.com. Thanks again for listening. And remember, menopause is inevitable. Aging is inevitable, but suffering, that's optional.